Let's talk about low sperm count. Now, this has affected a whole lot of people to the point that a lot of women have actually blamed themselves for their inability to carry or become pregnant or to make their husbands fathers, not knowing that it's actually because the husbands have got low sperm count, which they have not discovered yet. Now, what is low sperm count? It is, to a layman, it just means that the level or the amount of sperm present in a semen is very few. Now, when a man releases or ejaculates during intercourse, that fluid, the total thick whitish fluid that comes out, is not just called a sperm. It is called semen. S-E-M-A-N, semen. Now, this semen has a lot of other constituents that makes it up. Sperm is one of the constituents of semen. So if sperm is very little, the quantity or the volume of sperm to make up the whole, semen, if the quantity of sperm is actually very little, it means the man has low sperm count. So it does not mean that, some of us might argue and say, I usually release a large quantity of, sperm anytime I go into my woman. That thing you release is not called sperm. It is called semen. Sperm is only a part of what makes up the total volume of what you release during intercourse. And sperm makes it possible for fertilization, or makes, fertilizing an egg possible. All the constituents that makes up the semen are very necessary for fertilization of an egg in a female to take place. Now, let's come to what causes low sperm counts. I'm going to categorize them into 4 major causes. Number 1 is lifestyle. Smoking, excessive alcohol consumption are the 2 major causes when it comes to lifestyle that results in low sperm counts. Now, let's talk about alcohol consumption. I'm not saying do not drink. I'm talking about excessive. There are people who cannot go a day without having like 5 bottles of beer, 6 or even 7 bottles of beer. Yes, a lot of times they are so addicted that if a day goes by and they don't take it, it feels like they begin to shake. That craving is always there. It's either they are bored or maybe they are social drinkers or whatever. But I want to let you know, for those of you who might want to argue, that excessive alcohol consumption reduces your sperm count. Now, let me explain how this happens. Too much of alcohol, number 1, will affect the testicles. The testicles are those 2 balls present in your scrotum. Now, where is the scrotum and what is the scrotum? You see that sac, that small bag that hangs down behind your penis? That is called the scrotum. And inside there, when you touch it, you can feel 2 balls. Those balls are called the testicles. That is the engine house of fertilization. That is where the sperm is produced. So if anything affects it, there will be a problem with your ability to actually impregnate a woman. So excessive alcohol drinking does what? It reduces blood flow to the testicles, it reduces oxygen flow to the testicles, it reduces nutrient flow to the testicles that are essential to make for healthy sperm production. A lot of people might want to argue this. Coming to smoking, number 1, cigarette contains certain chemicals and toxins that affect the testicles directly. How do they do that? Number 1, there is a certain nutrient that is called zinc. It is very essential when it comes to sperm production. But for a smoker, chronic smoker, the toxin that the cigarette contains reduces the level at which the nutrient zinc is supposed to actually flow to the testicles. It reduces oxygen flow as well, just like alcohol, and reduces blood flow, essential for sperm production. And when there is an effect with the engine house, the rest will be history. Another cause of low sperm count is environmental factors, which includes heat. Heat is not good for sperm production. You stay under the shower for a very long time with hot water, my dear, that has an effect on your testicles. Wearing tight underwear, I've said this before, it makes heat, it traps heat, within the environment of the scrotum, making it unsuitable for, sperm production. So as much as possible as a man, avoid excessive heat around your testicles, around the scrotum. When you come back, please remove your clothes if possible. If you can stay without even wearing an underwear when you get home, please do. Not after wearing underwear for 12 hours During the day, probably you're at work and you come back, you still pack another one to sleep. Allow the scrotum to breathe. Now, not ideal. How can fat make a man's sperm count low? Listen up. Now, when a man is excessively fat, there is a hormone called testosterone. This is a male sex hormone directly connected with sperm production. When a man is excessively fat, this hormone is converted to another hormone called estrogen. And estrogen is the opposite of testosterone. Estrogen is a female sex hormone. So as a man is excessively fat, his own male hormone called testosterone will gradually be converted to a female hormone called estrogen. The more fatter he becomes, the more the testosterone keeps converting to estrogen and reduce sperm production, because when the level of this testosterone, which is essential for sperm production as a man, is going to definitely affect the production of sperm or the quantity of sperm present in that man's total ejaculate. Do you understand? And excessive fat also will lead to what we call insulin resistance in a man. This has to do with hormone balance. So for a man, when you start getting excessively fat, please try to see how you can put yourself under control, your weight under control, maybe through diet control or engage in some exercises. Obesity is not good for a man in terms of fertility. Infection is one of the causes of low sperm count. Sexually transmitted infections. The most noticeable sign of low sperm count is the inability to get your partner pregnant, especially when you've consistently had regular intercourse with your spouse. You are unable to get your spouse pregnant. She has gone through all the tests and they said she's okay. She's done scan and everything is okay. Her womb is okay. Fallopian tube okay. Everything okay. But she's not getting pregnant. I think it's time for the man to actually go for a semen analysis. It's not because we want to cast blame, but it's because we want to actually know what we can do to reverse this. As a man, you discover you have low sperm count, you went for a semen analysis and you were told you have low sperm count. What can you do? Number one, lifestyle modification. If you're the type that drinks excessively, you need to cut down on it. If you're the type that smokes, you need to quit smoking. Now, let's talk about medications that can actually help to boost sperm count. Number one, we talk about antioxidants and supplements such as zinc tablets. The function of zinc cannot be overemphasized. It's very essential to boost sperm production and quality. Vitamin C and vitamin E, these two are very important. They are antioxidants. They help to reduce oxidative stress, thereby boosting sperm production and count. So take vitamin E, take vitamin C, take zinc supplements. Folic acid is very essential. It boosts sperm production and count by improving blood flow to the testicles. Coenzyme Q10 is a supplement that has proven to be very effective in improving sperm production, sperm count, and even sperm motility. That's the movement of sperm. Take note of these medications I've mentioned. Number one, I said zinc supplement, folic acid, vitamin C, vitamin E, and coenzyme Q10. They are very essential to boost your sperm count and quality. If you take them for 3 months, I bet you go back again for that semen analysis, you will discover that the sperm count and quality has improved.